Thank you for joining us. The webinar will begin shortly. Good afternoon, everyone. Welcome to the first episode of PYA's Healthcare Dealbreaker series. Today's topic is IT nightmares that could kill the deal. PYA is happy to present today's webinar on this important topic. You may submit questions during the webinar by typing a question into the questions pane of the control panel. Also, immediately following the end of the webinar, you will be asked to complete a short survey and submit any additional questions. We will respond to the questions posed after the webinar via email. We have posted in the handouts pane of the control panel a PDF copy of the slides for your reference. Also, you will receive an email later today with a copy of the slides and a recording of the webinar. With that, I would like to introduce Merle Glasgow, who is going to give us some insight on our Healthcare Dealbreaker series.
Good afternoon, everyone. Thank you for joining us for our first Healthcare Dealbreakers webinar. I'm Merle Glasgow, a principal with PYA based in our Nashville office. The purpose of this series is to help investors and providers recognize the sometimes hidden risk inherent in healthcare transactions. As we all know, healthcare transactions can present significant opportunities for both investors and providers and can be critical components for strategies that help achieve initiatives such as improved quality of care, more access to care, health equity, to name a few. But these deals are very detailed. There can be drastic consequences if the parties involved are not aware of the risk. Each quarter, PYA executives will share with you some of the hidden deal breakers we see and how investors and providers can avoid them and succeed in their healthcare ventures. With that, I'd like to turn it over to my good friend and colleague, Barry Mathis.
Thank you, Merle. Thanks again for everyone taking time out of your day to share an hour with me. What you're going to hear and see, if you've been through a merger or you've been part of an acquisition team or integration team, you're going to recognize a lot of these, and hopefully you can find a few tips in there, and I'll share with you, a couple of actual examples where things didn't go as everyone thought they would, and maybe cause you to ask a question or two in your next diligence from an IT perspective. And then there are those of you who have maybe never been through this, or you're getting ready to go through this, and fate has smiled upon you because there's lots of little nuggets in here I think you can pull away from this. So both ends of the spectrum, we hope to find something in there for you and talk about the nightmares that could actually kill the deal. As Merle said, I'm Barry Mathis. I'm an equity principal at PYA over IT advisory and consulting, and I've done a lot of these over the years, been doing this about 30 years, and I've been on both sides, actually almost a quadrant. I've been on both sides in the operational as a CIO, CTO, or compliance officer, and I've been on both sides as a consultant, both for the parent company doing the acquisition and the target being acquired. So I've got a lot of different perspectives in there, and you're going to hear some of that throughout this. What we're going to talk about, kept it simple, 4 basic things. What do we actually do during an IT due diligence and assessment? And specifically because cybersecurity is a very big buzz right now, how can cybersecurity specifically wind up killing a deal or at least derailing some of the things we had thought were in the deal? And then for some symmetry, I've got 5 risks and 5 successful tips to help. Now, granted, there's probably a lot more than 5, but it's a webinar, it's a presentation. 5 and 5 seems kind of nice. Each of those will have subcategories. Undoubtedly, there's going to be things that in your situation, for example, if you're an academic medical center listening, we may not talk a whole lot about research in this, but that's obviously one of the places that you're going to dig into. If you're a behavioral health, there's other hardware and software details that may be in there that's not necessarily mainstream. So there's going to be nuances to this. So that's my caveat there. It's not a one-stop fits all. And when we get to the 5 steps for a successful IT due diligence assessment, then that planning and what's in scope, that's going to come back into play because that's really key to the success. Moving on. So what do we do? Okay, what should you do during an IT due diligence assessment as part of a mergers acquisition. It could be a private equity investment. It could be, an IDN or academic medical center acquiring moved facilities. It could be a divestiture, for that matter. It could be the unbuckling, or as the IT call it, nothing's ever unbuckled. It's unvelcroed, because things are so tightly tied to the technology. It takes a lot of work to get that done correctly, to undo it or to assimilate it into what you're currently doing. So what do we do in those cases? Well, this is, for each one of these, you'll see a little section. This is kind of my blurb on how important it is. It supports post-acquisition. When we do one of these, and again, it kind of depends on who we're doing it for. For example, we have some of these that go fairly quickly. They're very high level. It's on behalf of the investors, the banks, the lenders. And they simply want some high-level security things, anything that's really going to put this thing into a regulatory spin. And they understand, they go ahead and account for there's going to be hardware upgrades, there's going to be software changes, contracts canceled, all that's boiled into an acquisition kind of thing. And they're really looking for some high-level stuff. And then we've got, say an academic medical center who acquires, or an IDN who acquires a couple of hospitals or a bunch of practices. They want to go a little deeper. They're going to have to do the integration afterwards, and they need to know as much as they can about what's there that could be a risk for that integration. So what we're going to talk about is what we do for that, and towards the end we'll talk about how some of these things can actually derail, and in some cases potentially kill a deal. So I've called it the top 10. And within those 10, there's a lot of subcategories, but let's start with some of the basics. It's the low-hanging fruit: IT infrastructure and architecture. This is the one everybody understands. We all have phones, computers. Even in the finance world, we understand capital investments and the things that go along with that, asset inventory management. So that's obviously part of this, right? The scalability, things that we find, again, as we go along. I'll kind of touch on things that could kill the deal. The hardware, not necessarily kill the deal, but it could rearrange the deal. For example, in an actual occurrence, we had a hospital that we found out that 2/3 during a deep dive, and neither the hospital management and they were kind of the target, nor the parent company, the IT groups, neither one caught this. But with our diligence and what I'm prescribing for you, running a few simple tools from the vendors, we found out that very quickly, within months of the transaction, 2/3 of the critical infrastructure, their routers and switches and cores and things, were going to go out of life, end of life, out of service. So did it kill the deal? No, but everybody went back to the table and said, okay, there's going to be X millions of dollars that have to be spent probably within the first 6 months of the transaction, and that changed the nature of the transaction. Okay, so that's kind of how some of the hardware, it's not going to kill it necessarily, but it certainly could change the nature of the transaction financially and from a time, because you can't install these things overnight. You have to build some time in there, and likely, and you guys if you've done mergers and acquisitions, you're familiar with transition services agreement. All of those things are impacted by those kind of findings. Data management and data integrity, it's one of the things we see left out the most, but it is extremely important, especially if you're involved in healthcare information exchanges. If you're doing quality reporting, you're now assimilating all of the new quality reporting, and knowing whether or not you're reporting the right thing from a compliance standpoint, or from an efficiency standpoint, or from an integrity standpoint is extremely important. Is that going to kill the deal? I've never seen that particular thing kill the deal, but I've seen it stretch out and kind of morph into its own project that made post-transaction a lot easier because they identified it early on. Security and compliance, wow, that's a big one. A lot of these other things can be tied to security and compliance. The last thing you want to do is invest in a target and find out that their security posture would never meet up to what's yours. Okay, and we've had numerous examples of that, to where even the very basic connecting the two networks were postponed, in at least one case, almost a year. So everything else attached to that. So if the networks aren't talking, right, when we certainly aren't assimilating the EMR, we're not changing things out. Our email systems can kind of in the cloud talk to each other, but it impacts everything. So in the diligence, we absolutely, and you should spend a lot of time around security and compliance. Have they had a breach? Have they had some kind of report? One of the things you should ask for, and again, if you've done this before, likely you're doing it through the lawyers, as we do with most of the ones we work with, they're going to ask for all of that information. Are you under a corrective action plan? Are you under a CIA? Have you reported a breach, had an incident? And if so, what's the status of that mitigation? Have they completed in the last 6 or 7 years, every year, a security risk analysis? One of the things that we asked for up front in the healthcare spectrum, were they participating in incentive-based payments? If so, then they will have to have attested during the year they receive those payments that they have completed certain things. And one of those is a security risk analysis in accordance with 164.308 for HIPAA, and then NIST SP 800-30. So it's a very simple question for us. If we can't see that, it's one of the things, maybe it doesn't kill the deal, but it could change the nature. You may say, before we close this, during the transition services agreement, you need to pay to have this done by a third party, and our consultants and investors need to see that. Again, didn't kill it, but certainly changed the nature. Software and applications. Wow. I've seen this one impact a lot of these, and a lot of it had to do with the licensures with some of these, but absolutely everybody thinks of the EMR, which is a big piece of this. If you're on Epic and they're on Cerner, or they're on Cerner and you're on Epic, or there are 25 or 30 clinics involved and they're running a hodgepodge of eClinicalWorks, Athena Health, CPSI, all kinds of things, then understanding what that is, what those contracts look like, what kind of application inventory they may have. So when you start to matriculate that over, mainly how much money, how much time, and what downstream is going to be impacted, you need to know that. At a simpler low-hanging fruit level, just doing a survey of their Microsoft license, okay, or if they're running, PeopleSoft or Workday or something like that, those license, are they in compliance with that? A true story, went into probably a 300-bed hospital, fairly innocuous acquisition. Everything's really neat and smooth. And then we get to the license piece for Microsoft to find out that the former IT director, because again, it's a community hospital, there's not a CIO in place, or there wasn't at the time. And the staff had been making images of systems, doing their job, thinking that their license was okay. But when the diligence was done, it turns out that they were out of compliance with license to a severe degree, almost $1 million on the table. Again, excuse me, did that kill the deal? No, but financially certainly changed the configuration, okay? IT operations and support, very important to understand how they're currently supporting. A lot of that'll get worked out in the transition services agreement during the integration as you matriculate and assimilate over into the parent company. But at least understanding what the expectations, what levels of services are there, the software that they're using, is it the same platform as you? How long are they going to have to pay for that? Do they have call pay, which you would think is a fairly simple thing? Paying even IT staff, working out call and call pay is a significant deal, especially in something like a merger or a transaction of this nature. So understanding all that's important. Now, will that kill the deal? I have seen some smaller acquisitions for maybe not, an IDN or academic purchasing, a 400 or 500 bed hospital or system. That's probably not going to do it. It's certainly a lot of conversation. It certainly impacts the integration planning piece of it. But I've had other healthcare related companies, software companies, smaller, where they're buying mom and pop systems and things like that, that it did close the deal out. It's like, look, we simply are not going to be able to do what they're doing. If we did that, it's going to take money out of ours, and it kind of killed the deal. But larger ones probably not, but from the smaller ones, it could have a huge impact. Financial analysis, Obviously, this is the absolute low-hanging fruit. From an IT perspective, you're going to be focused on what their budget process has been in the past, how that may assimilate over into what your budget process is. Again, not necessarily going to kill the deal. Capital expenditures, operating expenses, understanding all that, but stalled initiatives, okay? This is one that I think, this is kind of mine. I threw that in there. This is specific to even things I've had issues with as a CIO and a CTO. Now, IT people know what stalled initiatives are. We have another word for it. It's called shelfware, right? Somewhere down the line, a committee, governance or board or somebody approved the purchase of software because it was a good idea at the time. Maybe it was half implemented, maybe it was implemented but never adopted and assimilated through the organization, and it sits on the shelf, but yet you're paying a monthly fee. You would be shocked to find out how much of that may still be in a lot of the acquired targets. And knowing that up front and getting shed of that before you bring it on as your risk is a one. I think it's extremely important to the health of the transaction going forward, but it certainly gets rid of a lot of headaches if you can deal with it up front as part of the configuration of the deal. You don't want to buy shelfware, right? Let the lawyers do whatever they have to do to get rid of that before you get it. Will that kill a deal? If it's big enough, again, depending on the constructs of the deal, some of those stalled initiatives are pretty massive. I mean, you're talking 8 figures. And either you accept that risk and bring it on it, or it's something that gets carved out. Sometimes when you go back to the target and say, well, you have to pay for that before, the target says, well, we simply can't do that, and it can actually kill the deal. Human resources, organizational alignment. Again, not necessarily a target for killing the deal, but certainly a very integral part of the transaction, post-transaction, everything from benefits plans. And it's not just the IT, this goes with the entire organization. But IT has a few nuances, again, call pay and things like that. Skill sets and alignment. You may find out that 100% of the target IT staff are not going to be able to operate in your environment. So what do? Well, there's a human factor there. There's an ethical factor there in some cases, but there's certainly a support financial factor on how you go forward with that. So we don't forget the human resources piece of it. Strategic alignment. This one, from an IT perspective, really has a lot to do with the EMR themselves, your primary systems, what type of other integration systems you have, and we'll talk more again in the data integration piece of that. But strategic alignment, are you a Cisco shop? Okay, and they're not a Cisco shop. Are you a Microsoft shop and they're a Google shop? Those kind of technology alignments, again, could it likely not going to kill the deal from an IT perspective? It'll certainly, make their day horrible, and they may want to kill the deal. But from an investor's perspective, you're going to push through it. But it could impact the timing. It could impact public perception of what's going on, which could harm the deal in the long run. If something you said in the overall acquisition plan, we expected to have this cancer center spun up by X date, and because of these strategic alignment pieces, you missed that by 18 months. That's going to impact the perception of the deal publicly, and that could wind up with a harm. So knowing about that ahead of time to be able to say, because of strategic alignment, we expect this to happen at this time, which is much later than what you would like, but it's reality because of the technology alignment that we have. Knowing about that prior to closing can absolutely make the difference between something that everybody, including the public, thinks was a great idea to something that's financially great, but from a public perspective was just a nightmare. Contractual obligations, liabilities. Obviously, going through this, we've got our attorneys with us, and the attorneys will look at the contractual obligations and the liabilities, limitation liability, and they'll help us with that. From an IT perspective, what we're most concerned about, and pay attention to this because this has bitten some people, a lot of things are happening during the mergers and acquisition fog, okay? A lot of hurry up and wait, a lot of decisions, and in that you may have significant contracts, okay, with automatic renewal dates that could click over while you're talking about the transition. So one of the things that I tell anybody going through this, one of the things that I personally do very early on is get the date. Now, they may not send you the contracts because there's somebody right now thinking, well, Barry, we don't always have the contracts. It's like pulling teeth to get a lot of things out until certain things are signed. Look, I get it. I've been there. But you can still ask the question, okay? You can ask it through their attorneys. Of all of these IT contracts, do we have any that are end of life or end of term by this date? Even if it's a year after the transaction, you want to know that up front because, again, huge impact if it's a large, hopefully it's not the primary EMR, but there are other large systems out there, lab systems, PACS systems. It may not all be an integrated EMR. There could be disparate systems out there that are significant. So understanding all those pieces. Lawyers will help you the rest of it, but from an IT perspective, at least understand what you're going to have to renew or not renew and what happens automatically. Integration planning. Can't start soon enough. I have a lot of colleagues, I can mention by name, probably one of the best in the business would be Michael Ramey, one of our colleagues, and he'll tell you same as I do, you can't start soon enough with integration planning. So from an IT perspective, again, what we're looking at is the systems, their likelihood is part of this that we just talked about, strategic alignment. We're starting to build that integration plan the very first time we're looking at the other risks. Okay, we're starting to put that together so that we can help, and you should do the same as quickly as you can. Start to put together the plan for integration, and if nothing else, you're going to get a much truer picture when somebody says, what's the lift for this? What's the timeline? Now, cost may vary because a lot of things have to go into figuring out those costs. But for those of us who've been doing it 20, 30 years, you tell me what systems you're on. Well, they're on Cerner, we're on Epic, we're on PeopleSoft, for our ERP, they're on Workday. Within a pretty decent amount of accuracy, we can tell you to a month, look, that's not a 12-month initiative, that's an 18. It's not a 9-month, that's a 12. Getting that into a plan early can make your headaches a lot better. You're going to have headaches. Don't let me fool you. If you're doing this, there's going to be headaches. There's no way around it. It's good, tough work, but the outcome's worth it. That's what the investment's about. But getting started on the plan is going to help alleviate some of that. Okay, so again, that's kind of the top, in my opinion, 10 things that we do. Now, there's a lot of little nuances under each one of those. We could teach a master's course in what each one of those things do, right? But at a high level, those are the things. There are other things, again, if you're an academic medical center, if you're behavioral health, if there are things that are individual to whatever industry you're in, there may be other things you want to look at. And most of us, companies that you work with like PYA and others that have done this for a long time, we're going to be able to advise you through those as well. So I've tried to make this as general as possible. So how could cybersecurity, just cybersecurity itself, how could it impact an acquisition? Well, the reality is cybersecurity touches everything. It's mainstream. It's not going away. It's part of our privacy. It's part of the physical, the technical, system availability. Everything's digital today, so cybersecurity is absolutely going to be mainstream. So here's a few ways, and this was a question that was asked to me, hey, Barry, in your presentation, can you talk specifically about cybersecurity? So I pulled some stuff together. Okay, obviously regulatory and compliance. You're going to want to know, okay, a couple of things. Have they met all of their regulatory compliance obligations under cybersecurity? For example, have they done the HIPAA security risk analysis? If they do work or business, if it's a target that does advertises business in the UK, have they completed a GDPR? Have they done things outside? If they're doing in Canada, have they done, follow Canada's, Australia? There's all kinds of cybersecurity rules. In the United States, it's fairly straightforward. It's HIPAA. If they're doing payment cards, it's payment card industry. With 21st century cures, there's information blocking. So all of those compliance criteria could be lined up. And it's not a matter of yes and no, although early on, like we said, until certain things are signed, it may be a QA, yes, we have. But before the transaction is completed, there should be some artifacts that change hands. Through the attorney's workroom, through that data room we've all used before, where you can validate that here's 6 years of a security risk analysis. And why do I say 6 years? Because in my experience under an OCR or Health and Human Services investigation, they're looking at least 6 years back. They don't want to know, did you do one last year? they're looking at all those years that you may have been receiving incentive-based funds, and your CFO is attesting to this. Do you have a program in place to identify the risk associated to protected health information or privately protected information? And are you working that program for mitigation? What's the status of that? They want to see that. Well, we want to see that in a transaction as well. How much work is the new parent company going to have to do to close any gaps that may be there? Most importantly, is there anything they haven't disclosed that we may discover? True story. And without naming names and telling tales, we don't do that at PYA. So I'll get this to be very general, but it is an absolute true story. This was a company in the United States, a large ancillary type company who purchased or acquired another company of their same, but of a different name. And part of the acquisition, but they rushed through it, in my opinion. They were really interested in the stock ticker because it was a publicly traded, and they kind of shut down the other company in the other state and brought everything over. What they didn't realize was that company was already under investigation for potential a breach of HIPAA. And it was not disclosed because there was no finalization about it. It just recently happened. It wasn't hitting the radar. Nowadays, we should be able to find it, even just with a few inquiries on a couple of websites. But for whatever reason, it didn't. And soon after the transaction was completed, OCR from this other state, which was really weird, showed up at the doorstep and said, you're now under investigation, not just under this piece, but we want to see everything. Years went by. We were one of the firms they called to come in and kind of sit at the table between them and OCR. Had a happy ending. Federal government wanted millions and we settled for thousands. But it could have been avoided with a good due diligence like this, that we could have uncovered that, and they'd have said, look, one, you're going to have to separate all this. This isn't us. And sit down with the government and say, look, we're going to acquire this company. We got to figure out what we're doing here, as opposed to finding out later. So big deal, regulatory compliance. Cost of remediation, and whether it's a regulatory remediation or it could be one of these misaligned strategies or hardware, what is the cost of that? So cybersecurity itself, just to get it to a secured state, and it could be replacing hardware, it could be policy procedures, it could be bringing in a third-party company to do a lot of things. Whatever the cost of that is, cybersecurity has a huge impact just from the cost of the remediation if you have to do it. And now I put intellectual property and protection in there because it in the healthcare space, there's some of that, especially if you're because we do work for EMR, software companies and things like that. Now, if you're just a provider, okay, likely not going to be a whole lot of IP protection in there. But if you're not, if you're a software developer company, this is absolutely a big deal. Understanding the target, what they're doing with those, because in some cases, they may have contracts to use IP from another company that may not transfer. And it could be critical to whatever that is, and all of a sudden you've acquired them, that doesn't transfer. One of two things are going to happen. That software is not going to work without that piece, or you're going to have a hard time negotiating a decent deal with somebody who knows that you can't live without them. So understanding any kind of IP that may be in the transaction is key. And from a cybersecurity standpoint, there are some cybersecurity components and software that are directly related to that, where it doesn't work without this other technology. So understanding if that comes along with it, or do you have to buy it separately to keep your cybersecurity in check? That's one thing. That's if you're going to use. Now, if you're going to move everything over to yours and you're going to scrap theirs, then this is obviously not an issue. It's as if you're going to bring it in and matriculate it in as is. Business continuity planning, really the continuity piece, and from a healthcare standpoint, downtime, policy procedures, it's really more the DR part of continuity planning. If they don't, if you're going to keep them the way they are, where they're at, they're not going to assimilate into what your DR plan is, then understanding what you're going to have to do from a cybersecurity standpoint if they go down. So if they have a cyber incident and it takes them out, can they recover? Have they done it in the past? Have they tested it, even a tabletop exercise? Understanding what that environment looks like, in my opinion, is critical. So business continuity and disaster recovery. Consumer trust from a cybersecurity. If you find out they've had so many incidents that nobody's going to darken the door, then obviously you may not want to consider making the acquisition. Now, these should be upfront, right? You should be able to go out there and see very quickly. You would be surprised how many people don't ask. How many people don't go the extra mile from a public-facing trust model on the acquisition? Now, if you're buying a hospital, everybody knows, if you've been in a hospital business as long as we have, there's always going to be ups and downs in that space. But maybe something's out there that's historically or legacy that you don't know about, especially from an IT cybersecurity standpoint. Maybe they're still having to buy 3 years worth of creditreport.com or something like that. Understanding that, again, not one of the things that I think would kill the deal, but again, certainly change the configuration if you know you're going to have to bring on that liability. Insurance and liability considerations. Wow, this one's a big one. Okay. Likely the target already has an underwriter for several types of insurance to include cybersecurity. You have an underwriter for cybersecurity. That contract may survive. So the worst scenario is you've got two cyber insurance companies kind of banging heads against each other on who gets notified first and that. So getting the lawyers together, and by the way, that's the only way to do it. You got to get legal involved to work with those underwriter contracts, especially as you're moving things over as to what survives and what does not, because today it's not like it was 15 years ago. They're very exposed. The insurance companies had to put a lot of teeth into these things in order to do the underwriting, and in some cases they demand that if you have an incident, you must call the cyber insurance company. Well, the question is, if you've acquired this target, which one do you call, yours or theirs? So getting all that worked out ahead of time is a big deal. Integration challenges, we've talked about that a lot. I won't go much more into that other than from a cybersecurity standpoint. Security strategies and postures are not all the same between entities. And if theirs will not fold into yours, then you've got two options. Either staff theirs up, again, through the transition services agreement, which comes into play, that maybe for a period of time you pay them or a third party to maintain theirs as opposed to kind of get your staff up to their speed. Or you rip the Band-Aid off and say everything you're doing goes away, we're going to pull you in here, which has a huge cost to it. It's getting that decision to the table. All right. There's lots of ways to deal with it, but at least get that decision out in front of you to say, hey, these are the things we should consider. That's important from a cybersecurity standpoint. Impact of future growth from a cybersecurity. It's a little bit of a stretch. I get it. I put it out there simply because if you can't come to terms on some of the cybersecurity protection pieces, the technology and the policy procedures, then it's just going to drag out. You've got other initiatives. Likely it's part of this acquisition. You didn't acquire them because you wanted to be nice, right? You acquired them because there's an investment and a return on that investment. So impact of future growth means a lot of these nitpicky things that just kind of stay churning underneath can really impact whether or not that future growth occurs, because a lot of it is based on timing. Again, you're standing up certain facilities. If you can't get that center stood up because of a cybersecurity issue, all of a sudden there's 6 months of revenue that you're not receiving, which was part of your original pro forma. That can come into play. So it's a little bit of a stretch. I get it's not going to kill the deal, but again, it could change the construct. Okay, so we've talked about a lot of things you do during the diligence. We've talked about how cybersecurity, can affect directly in some things, and you're starting to hear some themes. We're starting to repeat some of the same things. That's by nature. These are the things that we're concerned about. So now I'm going to tell you the 5 biggest risks, in my opinion, and then 5 things that you can do to make it better, to make your diligence go well. Okay. So in terms of the five risks, here's my blurb again. You can't do this and be unaware. You can't go into an investment situation and not know these things. It's just too risky today with technology. So the 5 biggest risks when it comes to closing the deal. And again, we're repeating some things now. We get it. Data security and compliance. To me, one of the top. In today's world, one of the top, data security and compliance, simply because all the things it takes to mitigate those, it takes time, it takes money, it's a culture issue, it's a staffing issue, it's resetting tools. Now, you may be one of the lucky ones, right? To where your target is your EMR, they use the same technology you do, they're on the same protection devices, their endpoint protection is exactly like yours, and it becomes a matter of contracts and license. That's it. That's the rare. In a lot of cases with data security and compliance, you're fighting uphill because you're on one technology, they're on another technology. At some point, you're absolutely going to want to move your technology into both environments, the timing for that. So here's why it's at the top of my list. And you can do your own research here. There's several. Gartner has some things to say about it. Healthcare Information Management System Society, HIMSS, has some things to say about it. Verizon has some things to say about it. So listen up. During your mergers and acquisition fog, it's what I call it, okay, you are likely going to be 50 to more percent, okay, 50 and some plus percent, likely to be impacted by a cybersecurity or data compliance incident than you are any other time. I equate it to a patient on a table for an operation, right? As soon as you open that body up, it can get infected. So there's a lot of things you need to do going into it to keep that from happening, right? And we'll talk about that, the next 5 things after that. But that's the reason it's the top of my list. You're going to go through a lot of transitions on both sides, because in order to bring it in, things have to open up, things are changing, staffing, all kinds of things. So you're going to be more susceptible to some type of a breach, even a social engineering. Believe me, I spend a lot of time listening, even interacting with bad actors in the dark web and other spaces, just to understand how they think and what they do. And they absolutely understand that when hospitals or any business for that matter are merging, there's confusion. It's easy to slip in and say, well, I'm Billy, I'm working for this team and I need this information so I can complete this, right? And all of a sudden they've got access to information via social engineering that otherwise they couldn't get. And any other time of the day, you'd say, I don't know what you're talking about, we don't do that. But because you're going through this and people know about it, it seems plausible, seems reasonable. Again, that's the reason we have our lawyers involved, right? They set up that data room for a reason. In a social engineering fish like that, and it comes from all kinds, emails, phone calls, text, they're looking for some way to find your weakness during that M&A fog. All right, so data security and compliance, to me, is a big deal in the beginning. Integration, systems compatibility, and data integration. Again, likely the next biggest thing you're going to tackle is that data integration. That's we're on Epic, they're on Cerner, we're on Cerner, they're on Meditech, we're on Meditech, they're on eClinicalWorks, all of those kind of things. Now, the 21st century cures and rules around interoperability is making some of that easier, but it's going to be some time before it really evens out. So if you're going through mergers and acquisitions in the near future, this is still a pretty big deal. The main thing is the plan that goes into it. The risks are always going to be there, small and large, doesn't matter, they're always going to be there. Putting that plan together, putting the right team together, we'll talk about that in the next slide, but that's really key to how you deal with the systems compatibility integration. Start early. Again, if you've never been through this, find somebody who has. And I don't necessarily mean you have to hire consultants. We love to help people. That's our culture. PYA, front of the building, right up top, just help. We want to help. Okay, but there's likely some other folks that you may know through other associations, hospital associations, professional organizations, and you may be friends with that have gone through one of these. Take them to lunch, pick their brain, use this presentation as kind of an outline and say, what'd you do here, what'd you do here, what'd you do here? But do this as soon as you can. Don't wait until you're almost at the closing and transaction to do some of these things, because it just takes time on the integration piece. Culture and process alignment. Why is that third and not fourth? Culture is a big deal, because once you get your systems aligned, once you get your plan in place, you know what you're going to do. Getting the culture to accept, adopt, and implement that is a challenge on its own. Now, I'm speaking from the IT. Now, there's other people on here likely who have gone through these mergers and acquisitions, and they're looking at it from a Q of E, they're looking at it from a clinical, they're looking at it from a physician's. Those are all absolutely paramount and important. I'm just talking about the IT. Even the IT folks, just trying to figure out what staff's going to do what after the transaction. And it goes everything from systems who have CIOs, CISOs, what is their role, and getting that dealt with early on is a big deal. And there's risk associated with that. Nightmare story, didn't kill the deal, but nightmare story. This was one out in the Midwest and right in the middle of the transaction. Pretty much every resource we depended on from the old parent company to do the left. They're gone. Had to replace them with an overseas outsourced company. and it really slowed down and hindered getting the deal closed to the tune of almost 6 or 8 months. Okay, that impacted that original performance. So culture and process alignment is not to be discounted. It's extremely important. Understanding those pieces, making thoughtful decisions all along the way around culture and process alignment is critical, in my opinion, to the longevity and the success and the health of the deal once you get it done. Could it potentially kill it? It'd have to go really south really quick to do that, but again, it could certainly change the outcome. Okay. Again, IPs and licensing, we talked about that a lot. I'm not going to bring up every detail of that, but again, we've seen the licensing be a huge number impact to the construct of the deal, and even arguing over that through the attorneys to some point delaying the deal. So that's one reason I put it up there as one of the big risks. Okay. And then this is kind of the catch-all. Granted, it's you could put anything in this bucket: hidden cost and liabilities. They're all over the place. What I'll tell you is, if you'll follow the steps I'm about to go over with you in this last portion, last 10 minutes or so, if you'll follow those, you're going to find a lot of these hidden costs and liabilities. Number one, don't do it in a vacuum. Make sure you've got good legal teams with you. If you're not a lawyer, don't assume that because you understand contracts, you understand the liabilities associated with that. Get a legal team that understands that to work with you. But in terms, if you're an IT professional or a consultant, or you've been doing this a long time, you can certainly understand the SLAs and the terms and things that from a business to business standpoint, we encourage you to do that. So a lot of hidden costs, cost overruns can be into the multiple millions of dollars. Again, a lot of investors account for that. They put contingencies. I know the average that we see out there is anywhere from 15 to 20% contingency to account for some of these, but I'm telling you, I've seen some that would blow that 15% contingency out of the water because the diligence was rushed or they didn't go into some of these details. And from a compliance standpoint, or from a license standpoint, or from a hardware replacement standpoint, it's not the one, it's when you have all of those. So if I've got licensing issues, I've got delay issues, I've got hardware issues, I've got interaction or integration issues. And this one's 500, this one's 2 million, this one's $1.5 million. When you add all of those up, all of a sudden there's this huge paycheck, this tax associated with this transaction. Well, I mean, it's absolutely going to impact the whole thing now and going forward. It's going to put like just a sour note on a lot of pieces. You'll get over it. I'm just telling you. Reality is, years after the transaction, people will remember it, maybe talk about it, and you'll get over it. But my point is, if you'll do these kind of things diligently, okay, use what the word is. It's an IT diligence. Do it diligently. You can avoid a whole lot of this. And how would we do that? Let's talk about what kind of strategy, what kind of steps we might do. And again, in today's world, everything's digital. You got to look at the strengths and the weaknesses. You can't avoid that kind of stuff. So let's talk about 5 steps to a successful IT diligence assessment. Now, this is in the context of a mergers acquisition, but technically you could do this for a lot of different things. You don't have to wait for mergers and acquisitions. I realize our audience today has a lot to do with mergers, acquisitions, how these things may kill the deal. So for this last slide, let's change it up just a little bit. What can we do to keep from killing the deal? What can we do to even potentially avoid things that change the deal or the construct of the deal? Number one, you can't start preparing too soon. Okay, and when I'm talking about IT, now I know for a fact that there's conversations, boardroom conversations way early on before it ever gets to the IT portion of the diligence. Here's what I'm telling you. Avoid that. Get IT, subject matter experts, involved in the beginning, very beginning. Nothing you do is not going to touch technology. There is no avoiding that whatsoever. And there's so many pieces that can make it such a different deal. Get them involved. Define your scope very quickly. Now, again, sometimes your scope is defined for you based on the early construct of the intents and the early document signed, and you may not get to do the full scope until it's a little closer. I get that, but as soon as you can do it, do it. Get your clear scopes and objectives and your strategies for the diligence in place, and communicate it well. both sides, as much as you can. Again, understanding that they're not going to let you walk through the target hospital and talk to everybody. Typically, for those of you who have done this like I have, they'll have a group of people, okay, that's working with the integration. Some are IT savvy, some are not. You shouldn't be battling this with these people. It should be, if nothing else, an education, a collaboration, and both sides wanting to do this well. But at least make sure that between you understand what the scope is. Get it down. If the scope is too narrow, then raise your hand and go back to the investors and everybody and say, look, the scope's way too narrow. We can't tell you enough about this to help you alleviate any risk here. We just can't get there. And then assemble the team. And on that team, it's not just technology, right? Technical, legal, have financial experts. We bring financial experts into our IT diligence. We borrow them from other parts of the diligence, from the Q of E and things, because, you know, I'm not a CPA. I'm not a financial expert. I know what depreciation is, and I know you depreciate a server 5 years and an endpoint device 3 years, but there's a lot of other financial pieces with contracts and things that we want to understand. So get some financial assistance. And then business professionals, the front line, what we call functional teams. Have some functional teams involved in your diligence so that you understand, you know, workflow impacts along with the technology, align the business with the technology, and then start collecting the preliminary data, right? Your RFI, your request. We would love to. Our favorite thing is if they will let us, we'll attach a piece of software and we can suck out all the information we need really to do a lot of the technical diligence. Likely not going to happen on day one, very guarded from that, but you can start asking for specifics, data. A lot of people ask for specific documents, and it gets wrapped up in this, and this is a little nugget for you from somebody who's done a bunch of these. It's really not, to be honest, the whole document, yeah, we want it, we want to get it, but there may be 5 or 6 elements of that document that I'm really looking for, right? The 2 people it's between, what's the cost of that? When's end of life for that contract? What are the liabilities? What's the insurance liability there? Can you get me those 5 or 6 things from these 20 or 30 critical software documents? If you have an outsourced company, can you get me those things? And a lot of times, if you'll ask for the specific data, you'll get that long before you get the document, and that's going to speed along your ability to provide good advice for those in the investment side. Okay, and then moving along, the assessment of the infrastructure and systems. Absolutely, this is low-hanging fruit. If they don't have a good asset management system in place, then you're probably gonna have to work with them to figure out, either using your tool or a third-party tool or something, how can we get a good system, a good scan? And it's not necessary for the Q of E part of it. So we're not just talking about what physical assets may or may not transfer. There's other people dealing with that, and this could help them. But we're looking for more of, what is it that we're not going to be able to use in our environment? What can they keep over here? What has to be in a transition services agreement? Understanding that hardware physical layout. What do we have to deal with? You need to get that. And then analyze the network security. Again, are they Cisco? Are you Cisco? You know, what type of endpoint protection are you using? What are they using for? Do they have, you know, some kind of a SOC or a CIM? What's going out there? What are you going to have to do to either work with that or put something in place from a security standpoint? Review the compliance. Again, main thing, if they have third-party vendors, especially the large ones that are handling a lot of EPHI, if they have cloud-based services, you're going to want to pull in some kind of third-party review. Most of them are going to have some kind of SOC, SOC 2 or SOC 2 Type 2 or SOC 2 Type 1, a high trust, something from a third party that says that vendor has been approved to do work with that hospital. If not, that may be something you have to ask for prior to closing the deal. Could you get us a third-party review of that? We've been involved in some of those ourselves. And then review all those compliance pieces. You're going to ask about, again, we're repeating ourselves here, but it's the same theme all the way through. You're going to ask, when's the last time they had a breach? I always ask, when's the last time they had a scare? Because they'll tell you, because they had to report it. Yeah, we had to report this breach. I asked the question, when's the last time you were scared of a breach? You didn't report it because it didn't turn out to be a breach, but you were nervous. Sometimes they'll tell you, sometimes they won't, but it gives you an idea of how they react and how they triage incidents, right? So what kind of incidents was it? What was the triage like? Did the lawyers get involved? What is your process? Understanding that can help you dig down. Now, granted, all that may change when they come over to where you're at, but just asking those questions, you may uncover a few things that otherwise was not presented to you up front, okay? And then the integration planning, again, can't start soon enough, but understanding how they align and adapt with your business strategies, right, from an IT perspective. as soon as you can start working on it, the better, because it's going to come. Granted, this is necessarily going to kill the deal or keep you from killing the deal, but this is going to go a long way with the adoption of the system and the system processes of people going forward is working on that strategy. Create yourself a roadmap. There should be clear roadmaps that ties IT. We call them 2 in a box, 3 in a box, and eventually 4 in the box. And the 4 in the box is the acquisition target, the acquisition parent, the functional teams, and the IT teams all meeting and talking together about business processes, legal, liability, technology, all these kind of things, all working together to put that plan, because sooner or later you're going to have to implement that plan post-transaction. And then assess the culture and needs. Now, culture, a lot of it has to do, from an IT perspective, what the staff expects, what the physicians expect, what the clinical staff, non-clinical, in terms of IT support, what are they used to now, getting them acclimated to what the future is going to be like. In most cases, it's an improvement, but I have seen some where it was because of the large technology cost. So Target has the latest and the greatest bleeding edge, and the large enterprise bleeding edge would bankrupt the whole thing if you had to do that for the whole enterprise. So they maybe have something a little less. Well, that's a big culture. So they're going to go down. So here's the Target going to get something that technically they see as a level below where they're at. That's a tough one. And getting started on that, the conversations early is key to the adoption going forward. Do some type of risk analysis and evaluation. Even if they've completed a risk analysis, you should likely complete something against that, or at least validate what they've got. Take some time to look at the artifacts that they put together in that to understand whether or not it was the proper process, if they captured everything. But go ahead and do your own risk analysis if you have the time to do it. And of course, the financial analysis, I put that in there because the IT typically works hand in hand with the folks that are doing the Q of E and other financial analysis that may be going on. And then put together a risk mitigation roadmap that not only encompasses, when we do one of these, if you were to look at one of PI reports for IT diligence, whether it's something for the lenders and it's small, or something it's huge because it's for a private equity or a large IDN or academic medical center, we have pre and post. So we'll say pre-acquisition, these are things you should be concerned about. These are likely questions you need answered, and these are things could literally change the construct of the deal. This one's $2 million, $3 million, whatever it is, and we wrap that up for you. And then we have things that are like, look, it's significant, but it can probably wait. You're going to have to deal with it. And then we have things that are clear post-transaction. Post-transaction, you're going to have to deal with this. Chances, we don't have enough information based on the way it's dealing now to deal with it pre. But post-transition, here's post-transition by priority. Here are the things you're going to need to deal with. Those are, in my opinion, invaluable for those who are trying to do the implementation and integration going forward. So, and then the final construct, the execution and post-merger integration, the final construct, the implement, the plan. These are simple, basic things. We put them in here because, you know, if you follow the recipe, things should go really well. And then the last piece that we find is the very last thing on here is the very last ongoing monitoring and optimization. When the transaction is complete and the integration plan is completed, and we're starting to assimilate, we're starting to get some of that buy-in and adoption, that's not the end of it. There's likely going to be changes to contracts. There's going to be changes to support structures. There's going to be a lot of change. You should come in usually within 6 months, and then 12 months, and maybe 18 months after the transaction is over. And I'm speaking just for IT, to look to see that these changes that we agreed upon in the plan, did they happen? Because the decision was made for a reason. These contracts that were supposed to, maybe it was a deal where we would pay 3 months and then it would sunset. All of these contract decisions that legal help us, did they get done? You would be surprised how many times that once it's done and the fog picks back up and that daily life continues, that there's money left on the table. There's all kinds of things that are going on because people just didn't tick and tie and check and follow up. So for me, the follow-up's a big piece of it when I go through these. So, all right, we're at about 5 minutes till. And I know this is kind of virtual webinar, and I think there's ways to answer some questions if we do that, but I want to bring this to an end. Again, the main thing for me, one, if we can help, we'd love to help you. It's our culture. But I'll go back to this. This is probably one of the best slides that I gave you. Okay, the one up front with everything that we do, this is a good step. Now, the caveat is, having done this and you having done it, the timing of this may be different for everybody. And again, I understand that access to some of this data is just not there until certain points. But if you have it teed up and you're ready for when it is, it makes it a lot easier. Don't wait and say, okay, this document was signed, now what do you want? They should have sitting on their desk, we need the answers to these whenever that document is signed. So we're ready to go, right? If you wait, then it's just going to drag out, take longer to do. And to me, time, if there's a big killer of deals, it's just time. So much time goes by, things get convoluted. I've seen time kill a lot of deals because we just didn't have what we needed, not just the finance pieces to it. So with that, I hope there's some things in the presentation today that somebody out there gleaned as beneficial. Granted, some of you have been doing this as long as I have. This may just be a walk down memory lane, and you can tell some of your own horror stories as well. But be careful of licensing. Okay, be careful of hardware exchanges. Be careful of, the cybersecurity breaches and things that are going on. Make sure you understand that when you sign the deal and you connect those networks, then you're assuming all of that technical liability. So take some time to find out what risks are there and put the plan together to mitigate those risks before you sign that paper. Because once you do it, the deal's done, right? So you just bought the whole thing. Thank you for your time. I appreciate your attention. For those that are still on there that maybe have it left, but if there's anything I can do for you, I'm easy to get a hold of at PYA. You can call any number, anybody, and just ask for Barry. They'll find me. But if there's just a question you have about anything you're going through with regards to mergers, acquisitions, please call me. Happy to answer any question I can anytime. Thanks, Merle. Back to you guys.
Thanks to our presenter, Barry Mathis. Later today, you will receive an email with their contact information and a recording of the webinar. Also, all information on this and future episodes of PYA's Healthcare Dealbreaker series is available on the Insights page of PYA's website, www.pyapc.com. While at our website, you may register for other PYA webinars and learn more about the full range of services offered by PYA. Please remember to stay on the line once the webinar disconnects to complete a short survey and post any questions you may have. On behalf of PYA, thank you for joining us and have a great rest of your day.